Broadly speaking, the mechanisms of resistance to immunotherapy are certainly complex, but broadly speaking, I, in my mind, categorize them as things that are intrinsic to the patient immune response, meaning things that are potentially even inherited that impact the patient's immune response to a tumor, things that are environmental, including the microbiome, and things that impact the microbiome like diet and certain lifestyle factors. And then lastly, the tumor genomics and the tumor characteristics itself. And so how these three things interplay, I believe, impacts the response to immune therapy, and in some diseases and in some settings, and for some patients, one or more of these broad categories may play a greater role, but so I think they all need to be studied in parallel. So what we're doing is investigating both tumor genomics, microbiome, not only in the urine but in the gut as well, and as well as a germline sampling to try to understand whether there are maybe germline predictors. And the germline question requires a much larger sample size. So for that, there are international working groups that are, are aimed at addressing that question, to have enough of a sample size to see whether there are germline predictors of immune response. The other two areas, I think we've had a lot of recent progress, and there's been a lot of publications and presentations on both how the tumor genomics influence immune response, as well as, of course, the microbiome, which is what we're here today talking about.